Welcome to the Aesthetics Unfiltered podcast. We are Michelle Jones and Melanie Torres, two leading medical aesthetic nurse practitioners and great friends based in California. We uncover the inner workings of the booming aesthetics industry from both the patients as well as the providers' perspectives.
Join us for the authentic conversations about current and trending treatments, best practices, and the real issues people face with modern beauty standards. Any information or advice given is general in nature. You should consult with a healthcare provider before undergoing any treatment.
Hey everyone, welcome to our second episode of Aesthetics Unfiltered. I am your host, Michelle Jones, and my co-host is Melanie Torres. We are your medical aesthetic experts, nurse practitioners, discussing all things aesthetics. And today's topic is basically just kind of an overview of a day-to-day in the life of aesthetic nurse practitioner, as well as what we feel is trending this year in aesthetics. How are you doing today, Mel?
I'm great. I'm super excited about our second podcast. The first one we got through, and I'm excited to keep going. It's taken a while for us to get this in motion, but I'm super excited that it's actually happening.
Yeah, excuse the noise in the background. House cleaning is happening. We got to get, the life is busy and we're rolling with it. So it's more unfiltered. So yeah, we ended our last episode. We didn't get to basically what is an aesthetic nurse practitioner. I think it's such a niche industry that's evolving so fast. And I think everyone's day-to-day is the same, but very different at the same time, because it really depends on your area that you're working in, the skills that you provide, the services that you provide. I think it's kind of interesting just to know, and everybody provides different services out there in our industry. So I'll start with you, Mel. Tell me a little bit about your day-to-day in the clinic life.
Okay, cool. So I have been at my current job for almost exactly 2 years. So I work in Los Angeles in a really busy part of the West Side where there are literally 15 to 20 med spas, in a 1 mile radius. So people definitely get their choice of provider and type. So I work in a really zen, beautiful med spa that offers facials, massages, and then myself and one other woman, we do the medical aesthetic side of the offerings. And so I've kind of spearheaded it with this woman it was new. First, there were just facials and massages going on at this company for 6 years. And then because they saw the explosion of people getting treatments, and it really kind of goes hand. I think, medical aesthetics, I think really works well also with facials and skincare. It's really they synergize off one another. So I really think it's cool that we're doing both, Zen, natural beauty as well as, injectables and lasers and whatnot. So I work 3.5 days a week. You are a super amazing worker. You work 7 days a week. I work I like to just chill at my pool and kind of make juice, and I do ballet and stuff. So that's most of my week. And then 3.5 days a week, I work from 11 to 7 because I think it's important, because a lot of people come in after work, and a lot of plastic surgeons, a lot of clinics only work from 9 to 5, but I stay until 7 so people can come in after work to get treatment. I also work on Friday. I know it's not the best. I don't love it, and also Saturday morning sometimes, because people need treatments and they have downtime and whatnot. And so I kind of do my schedule to their convenience. And so I offer the main tried and true kind of best, when you go to med spa, I offer the classic ones that have been offered for the last 20 years, because we're newer and smaller. I want my clientele to first get those treatments, and then we're going to bring on, because technology goes so quickly, there's a new treatment every 2 weeks. But I do neuromodulators like Botox and Dysport and Xeomin. I do HA fillers, lips and cheeks, and tear troughs are really, really popular. I learned with great trainers on how to do tear troughs. So that's kind of one thing I focus on. And then I do a lot of micro needling, not radio frequency micro needling. I do, skin pen 101. But honestly, that's one of the most best treatments for resurfacing and collagen induction. So I like love it, you know, and I do it with PRP, platelet rich plasma, and then I do BBL, a Moxie and non-ablative laser with minimal downtime, and I also do Sculptra. I love, you know, the biostimulatory, the bio stimulants for collagen induction.
Yeah, I love that. I mean, I think aesthetics basically is a new field, and what we focus on, we're not dermatology or dermatologists, but we focus on basically the skin health is in terms of like cosmetic appearance. And so there's like an art and a subjective quality to that, because you know what I think is beautiful might not be the same as everyone else. But there's a lot of what you said, like classic treatments, meaning that treatments that have been tried and true, have been around a very long time, have a lot of clinical data on them that support that they work. They're very safe and effective. And I do a lot of those as well. And yeah, the treatments I provide are pretty similar. I do threads as well, and I do a ton of Sculptra. I'm doing a lot more Sculptra body. I do PRF, platelet-rich fibrin, which I've really liked. I think microneedling is like back in action. You know, it seems so basic, but now it's like, we'll go on to like what's trending, but sometimes it's just the basics that you need consistently, not these fancy treatments like once or twice a year.
Honestly,
So
the basics are like, you know, they work. You know, you have to do more than one treatment. I think a
yeah,
lot of people coming in are like, oh, I used to do that when I first started getting, oh, I just need like one chemical peel and my
yeah,
skin. Oh, by the way, I also do chemical peels and forgot there was one other one I'll talk about later. But yeah, doing one treatment is not
hmm,
gonna give you these results of this perfect skin you see everywhere. Not the ones with filters. Like most people's perfect skin actually has a filter on it, guys. So know that
yeah,
know that it takes work to have really natural, beautiful skin.
yeah. We can talk about filters. Pretty much everything you see online is filtered, in my opinion. Um, yeah. So, I mean, day to day, I think my schedule fluctuates, and I'm not really good with balance in my life. And I think that's why I gravitate towards you, Mel, because you're more balanced than I am. And I like
It
people
works
that
well. It's like yin and
I like,
yang.
don't like being around people that are too much like me, because I would drive myself insane. I'm like intense. So, but
But
yeah,
you're
I
awesome.
mean,
You're an artist. So like, you know,
yeah,
creativity and skill. You know, Einstein was intense too. He's like, you know, a creative genius, but people are intense. So there
thank
have a
you.
lot going on. Yeah.
Yeah, I think I need to find a little bit more balance in my life, but it's nice to have lots of options and be busy. And I like being busy. And yeah, I really only work 3 to 4 days in the clinic now, but they're really long days, kind of like you, and they're intense. And then I'll usually come in on a day off for if I need to come in for someone or someone can't get on the schedule. And then I leave my days open for trainings. People hire me to do trainings on filler mainly, and Botox, Dysport, Sculptra, and then I have
What
this
kind of people do you
podcast.
train? Like what in meaning training, what do you do? Like who do you train?
So like basically other injectors, like you have to be in the state of California, you have to be a nurse practitioner, doctor to 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 be trained, but usually just other med spas I train. So yeah, the pharmaceutical company basically will hire. I work for them. They hire me, and I'll go in and do a training, which is really fun because I get to network all throughout the community, and I learn a lot just from other injectors. We're always learning, so and I learn a lot about myself and how I teach and how I communicate. But I think I really do well with like entry level and the basics and like dumbing things down for people, but showing them multiple ways to do um, one treatment. Like I can show someone how to do your cheeks like 5 different ways and why I would use different techniques. And
That's awesome.
I
I
don't
miss
just
you. I
say,
wanna I wanna get trained by you again. It's like hard, you know.
"Aw, you're awesome."
Thank you.
Yeah, I just think my style is it's kind of like I don't just say it's my way or the highway, which I see sometimes. I like to kind of like tell people lots of different ways to get to the different results and like why I do each way. So I love learning, I love teaching, but yeah, life is busy, life is good, and now we have our podcast. So that's kind of how I spend my time.
How many patients, like what does a day in clinic look like for you?
I'm usually in the clinic from 9 to 6 or 9 to 7. Typically ends up being 9 to 7. And, I don't, what I hear a lot out there is people have these really rushed appointment times, and I just don't like that personally. So I have most of my appointments, like Botox, neurotoxin appointments, Dysport, is about 30 minutes. But sometimes in that appointment, we'll at least make a plan of care for their next two appointments. So I'm utilizing that time to talk to them about like, what are your goals and how can we keep maintaining you? So it's not wasted space for me. And I like to connect with my patients. Right now, I'm trying to have more fun as I'm working because,
That's smart.
I work a lot and I want to have a little bit more enjoyment, and I love my patients and I want to have a connection, have fun. So, and I feel like they want to do the same. And it's really right now, like I think the number one currency is attention. And I think there's a lack of attention. Like just having someone listen to you is a big deal,
Yeah.
and having someone's undivided attention. So I personally don't like shortening my appointments. And sometimes I'll add in a filler treatment at the same time if I think, we have the time, and, that gives me a little bit of wiggle room. I don't do like 10-minute appointments. I don't do 15-minute appointments. I hate rushing people. It's like a pet peeve of mine. I think that's where our medical industry is going, just in medicine in general. Like,
Yeah.
I don't even know if I have a primary care doctor. I just kind of like, it's so hard just to like,
It's so stressful. Thank
yeah,
God
and
we're getting
everything's
that
so rushed.
documentation, like AI. That's like the one I really don't like AI, but the one thing I'm
Yeah.
excited about is getting scribes and
Yeah.
documentation
Yeah.
for it. That's literally the one thing that's going to help us. And I'm actually really happy I'm a nurse practitioner because, our jobs, like, I wonder if in 20 years there's going to be a robot injecting Botox. I don't really see that happening because it's also an art form. I hope it doesn't happen, but I don't feel like my job is going to be taken away in 5 years because, we have
Yeah.
a lot to do as
Yeah.
providers.
The whole AI is such an interesting conversation. I mean, I don't know how it will affect aesthetics, but I kind of do see that happening in like maybe 20 years. Like I think there'll be like a little booth and you just program what you want to look like, and someone's like a little robot's just going to inject it for you.
So
That's my
intense.
theory. That's
Yeah.
my theory. It's scary. And
It's
we'll be behind the scenes like programming that robot, right?
right.
Um
I
who
mean,
knows? It's going to be
it's going to be
we'll all
crazy.
look the same. It will be scary.
Right. It's going to be crazy. Yeah. So hopefully they're not going to be like, hopefully our phones aren't going to be like recording us in our rooms, like doing treatment, because they're going to have to learn how to do Botox and stuff and how to connect with patients. I don't know. I'm having a panic attack thinking about this right
Yeah,
now.
let's
But
not think
anyway,
about it. I think,
yeah.
I think the artistry of our job is probably not in jeopardy for a while, but who knows what's going to happen. I think we're all a little like interested.
Yeah.
So, but yeah, so the day to day, I don't like to rush my appointments. It's usually pretty busy. I usually am very chatty. That's one thing. I'm usually running late. I actually like it when my patients are late, and I know that's terrible, but like I have OCD and a little ADHD, so I'm like having a conversation with you. I'm doing artwork. We're making a next plan. So I'm working on being more on time. And thank God I have the best medical assistant who helps me with that and everything else. But, one thing I don't want to become is just a factory. I think we're in this like niche aesthetic, like private type practice because it's luxury, right? And if we're just rushed, it doesn't feel luxury to me. It just feels like a factory. And that is something I am passionate about. So yeah, I mean, I think I see lots of things trending that are different this year or the last 2 years, and I think it's a good change in our industry. We can transition to that topic a little bit.
Yeah.
Yeah, I mean, what I see is like Botox and neuromodulators, like it's actually going up, and we're treating
Definitely.
more areas on the face and even on the body. So
Definitely.
it's becoming a bigger treatment. It's like there's more awareness to like neck platysmal band
Mhm.
Botox. There's more emphasis on Masseter, which became really big during 2020, and I don't know why on social media. Like I think everyone was stressed out and their jawline was huge, so they were like
Right.
staring at themselves and they looked so masculine, and they were like, ah, you
Maybe it's
know.
because like all of the celebrities were doing like the buccal fat remover,
Maybe
so it
that's
made
what it
them look
was.
thinner. So people are
Yeah.
trying to figure out of a way to make their lower face look thinner too. What is your thought on the whole like, you know, trolling drama online about saying that taking care of your masseters produces jowls? What are your thoughts on that?
I know that's such a viral TikTok scheme right now is the whole
Mhm.
masseter and TikTok thing. Sorry, my phone just went off.
Mhm.
I think there's extremes in every treatment, right? I think if somebody has already loose skin, and you completely take away their support system, which pulls their skin back, which is that masseter muscle, yeah, it's potentially could make their jowling worse.
Right. But if it's a
So
lot,
I
that's
think,
if you like knock them out with like 40 units per
yeah,
side. You can always just do a
yeah,
little, do a small dose just to help their grind. And like,
yeah,
then, do a little more to make sure that the jowl is good. And then you can always do like
yeah,
doing the DAOs, I think helps jowling because
yeah.
when you lift the corner of the mouth, it like slightly lifts up the jowl a little bit too. That's something I've seen.
Yeah, I think as long as, I think even if you're young and you do completely, you want a really thinned out like jawline or lower face, you want to be a lot of slimming. If you're young and your skin is tight, you probably won't have any jowling. Maybe you'll feel like a teeny tiny bit of laxity. But if you like that, like really like contoured, like thinned out jawline, then just take a little bit of 1 or 2 syringes of filler and just crisp it up to give it some support.
Yep.
Or you could even do the platysmal bands, the DAO, to tighten and lift a little bit more. You could do a vial of Sculpture to build some collagen in there. You could do some smooth threads. So there's a lot of ways to like get around it. It's just like, what is your goal? Is your
Right.
goal like slimming out, or is your goal like TMJ? And I always tell people like we are not pain management specialists, So like I never promise like your pain's going to go away. We do it for aesthetics, and as a side note, hey, your jaw will be like relaxed as well, and your pain will probably be better. But I'm very passionate about that too, especially with the trap talks. We can talk about that, but like I'm not a pain management doctor, so I'm not going to try to treat you for pain. I'll treat you for like
Mhm.
aesthetics, and as an end result, you probably will get some pain relief, but I'm not going to promise that. And I think that's where we go wrong as we see these trends, and then people are coming in for different things, meaning like pain versus like shoulder slimming, and then you're doing too much in treating areas that you're not educated in, and the patient's neck is like crooked to the side, or you hit like a neck muscle,
Right.
so it's like, but I'm getting off topic a little bit, but yeah, I mean, I think masseter, it's all about assessment, and it's all about educating that patient. As long as that patient is educated, they're not going to go and post a crappy TikTok of you and
Right.
like,
Well, also like 80% of the people on TikTok don't even have jowling yet. So like they're good, It's like, don't worry about it, guys. Like we'll start slow, and you guys aren't
it's,
gonna get jowls until you
yeah.
hit the 40s, so no worries.
Yeah, it's a little obnoxious. I think just things go on trend and then people blow it up, and it's like we're all aware, we're tired. But I think there is an art to assessing someone's face, having that conversation, and then really giving them ideas if they do feel like a little laxity, what you can do to keep the slim and also keep your skin tighter. So
Right.
there's an art to that. There's a lot, and it's all in the conversation, and that's part of our assessment, right? We have to really kind of deep dive into assessment of everything that someone could think could possibly happen, and that's our job, and because everything's available online, but
Yeah, because I
sometimes
know
it's
you're
confusing.
super busy. You're always like you're booked like 3 months in advance. Since I'm starting a newer practice, I have more time. But do you usually do treatment the same day as a consult because you're so hard to get in with? You know what I'm saying? Like, do you
Oh.
always do treatment the first time you see a patient?
It depends what the treatment is. I mean, if someone's coming in, like I definitely don't rush my consults because the consult is where we're kind of like dreaming and envisioning and like giving them lots of ideas. And I actually like my patients to feel slightly overwhelmed and I want them to go home and kind of digest what I said. But if somebody comes in and they're really adamant and they're like, I want Botox, I want lips today. And I think they're a good candidate. Of course, I'll do it if I have time. I try to really maximize my time and utilize my time. I also like really try to read the patient. And I think that's like the psychology of what we do. Like I'm pretty good intuitively understanding like patients' goals, understanding I don't want things to be rushed. So it's kind of like as needed, but I do try to be efficient. But if I'm getting the vibe that I never push anyone into anything. I think that's crazy. But if they're not 100% on board, I don't do it because I want them to be excited and ready to rock. And I don't want to convince anyone to do anything. I'll educate patients and I'll tell them my own experience. But I'm not a salesperson. I'm an educator. And if I get a good vibe and if they're a first time patient, and they're ready, then we'll go for it. And most of the time people are pretty prepared. Like they've researched me. They like know my work. They know my aesthetic. It's not like they're coming in blind. So, and that is the one good thing about social media is like, I think I don't really attract as many people that don't align with my aesthetic anymore because there's so many people to choose from now that people are really picky. And so that makes things better for me in the sense of like, I don't do crazy lip filler. Like I don't do nose filler just by choice. I could, it's pretty simple to do, but there's risk that I just like to sleep. So, I think people are aware of that. But I try to have fun and I think people they love the education. It's really people feeling comfortable and understanding like my train of thought and my vision for them. And then they get excited and they're ready to rock. But
what is your like average age? Because I know when I worked in the Bay Area, I had a much older clientele that had the money to do more treatments. Now that I'm in LA, most of my patients are like around 26 to like 33. I think the older patients already have been established with plastic surgeons because I'm a newer provider down here. So I have a lot of walk-ins that are like 26, 27 that are just learning, what can I do? What's my first aesthetic treatment? I want to learn about chemical peels. But when I was in the Bay Area, women were coming in are like, I'm down to do whatever. I just want a completely new face and I have an unlimited budget, so it's I have a different clientele now for sure.
And that's such a good topic is just like, what is your clientele and understanding your clientele, because even in the Bay Area, each little subset of the Bay Area is a different clientele actually. Like I think San Jose versus like Burlingame versus like San Francisco versus like Bay or East Bay, like Walnut Creek, like all of those are little subsets. And it took time to understand like my area and kind of like who's coming into me and why they're attracted to like my aesthetic. And like that took a long time for me. I think you're right in LA. I kind of can imagine like a younger aesthetic. Is interesting. Like I have a mix of everything and I feel like a lot of my clients are kind of like my age, if not, and I'm 40. I just turned 40. Yay.
Happy birthday. Your birthday was like last week or something.
Yeah, I'm in like a crisis mode, ready for like a tattoo and like a whole sleeve. I'm like envisioning an eyelid lift. I don't know what I'm doing anymore, but hormones are wild. Yeah. So I think a lot of my patients are like plus 10 years or minus 10 years of me. It's kind of like that, like that's kind of where I'm at. I used to have a lot of younger patients, I think like pre-COVID and right at COVID because
they had the money from the government.
Yeah, I think so.
Job was like killing it those 2 years because they had time to do treatments, they had
Yeah.
money saved up, they weren't
Yeah.
going on vacation, so they could do
Exactly.
lip filler. That whole lip filler craze in like 2020 was insane.
It was
I definitely think
insane.
it's died down for
Yeah.
sure.
Yeah.
um yeah, I
Yeah. Lip
definitely
filler in
think so.
2020 was wild.
Yes, it's definitely scaled back a bit. What is your like, so we're talking about trends in aesthetics. So what is your biggest trend you're seeing in your room, online? Like what is the hottest thing
Yeah.
you're thinking of right now in aesthetics?
I mean, right now the kind of key buzzword is biostimulatory, right? It's like any treatment that builds your own collagen is on fire. Okay, so it's like Sculptra, Morpheus 8, which is like microneedling and radio frequency, PRF, which is like I draw your blood, take out all your growth factors, inject it, all the anything that tells your body, hey, reheal, but reheal healthier is on fire. So, and I kind of like that. I actually think aesthetics in the future, and I'm starting to see this already. I was making sure my cat's still in the room.
No worries.
I think, I think it's going to become more like anti-aging clinics as well. It's going to, and that's already like, or there's already like a big podcaster as well in aesthetics that's talking about that and trying to create like education around that. And I think that's
Mhm.
awesome. I think it's going to be, I don't know exactly what that means, but probably hormone replacement we'll be doing.
Like Ozempic.
Probably,
I
yeah,
mean,
the
not to
weight
do that.
loss.
I personally, I mean, I don't know. I'm not ready to do weight loss stuff yet. I'm still learning about it. It's a new
It's a new,
practice.
yeah,
I want to focus more on like medical aesthetics. I
yeah,
wouldn't put that into our specialty yet. I mean, I think people are crossing over into it, but that's a huge topic,
yeah,
even though neither of us prescribe it. A lot of my patients come in and are like, hey,
yeah.
do you
They want
prescribe me
it.
Ozempic?
Yeah,
And like, I wish, I wish I could, but that's a full.
yeah,
I always say talk to your primary care doctor about it. Like,
yeah,
you need to have all your labs checked regularly and whatnot. So we don't do that
yeah,
yet. But my biggest trend I'm seeing, and I actually absolutely love it. I love Sculptra. I think you were right on the biostimulatory for collagen.
hmm.
My biggest trend right now in LA is Skin Vive, is the skin
Oh, yeah. I
hydrator,
didn't
skin
mention that. I'm doing
booster.
a ton of that.
Yeah, so that's the number one
Yeah,
thing I'm doing. Everyone, I love it. Like I
yeah,
get it myself. I see huge like best outcomes like around the mouth and just for
yeah,
these fine lines and pores. So I'm that, and you can do it with your Botox treatment because it doesn't
yeah.
take that long. So it can be an add-on. So that's what I'm seeing down in LA right now.
Yeah, I shouldn't even forget about that because I do a ton of Skin Vive and I actually think mine has just kicked in. That's why my face is glowier.
It looks
But
great, by the way.
yeah, I freaking love Skin Vive. I
Me
think it's a
too.
game changer around the mouth area for people where it's
I'm
like really
obsessed,
natural.
girlfriend. I
And
love
I
it.
love it in the lips too. I think it's
Mhm.
great. Necklace lines. It's so Skin Vive is basically a skin quality improver that's hyaluronic acid, but that's like the lowest dose of hyaluronic acid. It's like 12.5 milligrams, where a lot of the fillers are like 17 to 25 milligrams of hyaluronic acid. And it's meant to give no volume, but just improve the texture and appearance of the skin, fine lines, redness, pore size, lip hydration. I think it's fantastic. Yeah,
It has
that's
like
definitely been on
minimal,
trend.
yeah, minimal to low volume adding. So even though it's considered like it is an HA filler,
Yeah,
it's the same, it's an injectable, just like you would do injections in your lips or cheeks, but it's so thin that
thin.
it just fills in like the tiny fine lines, the
Yeah.
little. I've actually used it for really mild acne scarring. It helps
Oh
really
yeah,
well
me
for that,
too.
and it's not super expensive. It lasts like 6 months on average, so you
Hmm.
can redo it and it
Hmm.
doesn't make you look puffy. It's to me, I say it doesn't really add volume unless
Yeah. I
unless you
haven't
do
seen it add much volume. I love my lips the most when I had that in there. Like that's what
Mhm.
I thought looked really nice. And I've been doing like tiny bits under the eyes, like deep, deep under the muscle in the tear trough, like above the bone with like
Good to
maybe point
know.
0.1, point 0.2, just to like help the texture. And that's such a tricky area, but just doing like the tiniest finesse with that can make a big difference. But yeah, I mean, I think the moral of the story with the trends this year is like, less big volumes of filler in the face and more like collagen builders and more like refinement. And people
Mhm.
want things very specific and people want to look natural. Thank God. Thank God they
Yes,
want to look natural. So there's like a big trend
definitely.
towards that.
Less is
Also,
more and building up your treatment, but
yeah,
knowing that it really is subtle. Like people get
yeah,
scared when they do their cheek filler for the first time, when they start getting the laxity, like, oh my God, 2 syringes. I'm gonna look like, da puffy person. I won't name celebrity names, but we all know the main ones. But anyway,
ha,
just
yeah,
knowing that it's super subtle and even 2 syringes they get scared of, but then they actually need like 3 syringes per
yeah.
side.
And we
It's
can
hard to
talk
like,
about that. Yeah.
yeah, for
I
sure.
mean, you can really look natural and do like 5 to 8 syringes of filler. It's just how you place it, where you place it, what products you're using. That's where the art of it comes in. I mean, I probably have like 10 to 15 syringes in my face. If I didn't, I would look like I was dying, like honestly.
Right.
So thank God. But
Yeah. When
I
I
think
did my
it's,
boyfriend's jawline, he has a lot of laxity. He's like a bit, he's like a football player. And I did 2 syringes of Volux, which is
mhm,
on label for jawline, and then
mhm,
I did 2 syringes of Voluma, and like he literally needs like twice that amount. Like you can see a subtle difference. I'll
yeah,
post the before and afters, but
yeah.
people need more filler than people think.
Yeah, and that's what's hard is like that's what I think is the negative of this year. What I've seen is like because there's been so many, I guess, celebrities that look too done or too crazy that everyone assumes it's filler. Like I don't think Madonna's face was filler. I think it was a fat transfer and her face was just puffy and then it like took a while to calm down. I'm sure she has filler in there as well, but I don't think it's all filler to blame.
Right.
I think some people are, but there's lots of different types of filler. And, I just think the public got scared and then they like drew back completely. And like,
Yes.
it's like we still need volume as we age,
Yeah.
and it's,
It's still
it's,
the best way to
yeah,
subtly with non-surgical methods to like add natural volume back to your face that, and losing volume causes wrinkles and causes sagging. So
right.
the best way, honestly, in our industry is to do a little bit of hyaluronic acid filler.
I think so too. I think it's, I think it got a bad rep just because maybe it's a learning curve. I think filler is the biggest learning curve actually. It's like I think you really have to be an artist. There's a lot of scary things that can happen. We'll have a whole complications like episode as well, but I think that is an art for sure, and it takes a lot of practice. And I think when we have so many new injectors coming into the industry, I mean, I'm not going to blame new injectors, but I think there is a learning curve to filler, especially, and looking natural.
Well,
And
it's also like your art, the look of your aesthetic, your
yeah,
person. That's why we call this aesthetics unfiltered. It's like having a good aesthetic. It's an art for it really is art.
yeah,
So you've got to you've got to look at your provider's work, their before and afters, ask them if in your consult if they don't have social media. You don't have to have social media if they can show you some before and afters in the room.
hmm,
Just make sure you're on the same page as the person that's going to be performing the procedures on you.
exactly. Yeah, so I think those are really the trends. It's like we didn't even get to all of the treatments, but we can break down each treatment in depth. But I'm definitely seeing more neuromodulator treatments. I'm seeing more biostimulatory treatments such as Sculptra, a lot more even radius, hyperdilute radius. I'm starting to do. We could talk about that. And I'm seeing, I think last year the trend was dissolving a lot of like overfilled lips and redoing them. So, that was happening as well. And we can go on to dissolving, what to expect. We can go through all that in the future as well. Like,
Definitely.
well, do you have anything else to add, Mel? I think this might wrap up
No.
our second session here.
Yeah. Let's we're gonna record another one soon and we're gonna get them out to you. I think we're doing this weekly, right, Michelle?
we're going to try at least
All
one to
right.
two, at least by every other week at the latest. So plan on every other week, and we might throw in some bonus ones every week for you.
Awesome.
But yes, send in your questions. Follow us on Instagram. I'm skin.smarty.np, and our podcast is Aesthetics Unfiltered Podcast on Instagram, and then Melanie on
I'm
your IG.
Melanie at melanie.skin.np on Instagram and TikTok. And yeah, send in your questions to any of our handles, and we are going to talk about them on this podcast.
Yeah, and this should be a fun, safe place just to explore a lot of different topics within our industry. Thanks, guys.
All right, see you soon.
For our latest news, follow us on Instagram at aesthetics.unfiltered.podcast or in our personal pages on Instagram.
Mine is melanie.skin.np and Michelle skin.smarty.np, both on Instagram. Have a great day.